Welcome to the gateway of self-awareness and holistic health, where we unveil the critical insights into the intricate world of liver well-being. We embark on a journey to decipher the 12 subtle signs of liver damage, often overlooked in our daily lives. Your liver, a silent guardian of your health, communicates through distinct cues, from fatigue to changes in complexion. This guide serves as a beacon, illuminating the pathways of understanding your body's language. Join us as we delve into the crucial realm of liver health, empowering you with the knowledge to recognize, address, and safeguard against potential damage. Let the journey to vitality begin. Number 1. Jaundice is a significant indicator of liver damage, characterized by the yellowing of the skin and the whites of the eyes. This condition occurs when there is an accumulation of bilirubin, a yellow pigment formed from the breakdown of red blood cells. In a healthy liver, bilirubin is processed and excreted in bile. However, liver damage, whether due to conditions like hepatitis, cirrhosis, or bile duct obstruction, impairs this process, leading to bilirubin buildup in the blood and subsequently in the skin and eyes, resulting in jaundice. It's often accompanied by other symptoms like dark urine and pale stools, necessitating medical attention. Number 2. Abdominal pain and swelling, particularly in the upper right part of the abdomen, are common signs of liver damage, often indicative of advanced liver disease such as cirrhosis. This swelling, known as ascites, results from fluid accumulation in the abdominal cavity, a consequence of liver dysfunction. The liver's compromised state leads to decreased production of proteins like albumin, which helps maintain fluid in the bloodstream, and increased pressure in the blood vessels of the liver, portal hypertension, both of which contribute to fluid leakage into the abdominal space. This condition can cause discomfort and requires medical evaluation to manage the underlying liver issue. Number 3. Swelling in the legs and ankles, medically termed as peripheral edema, is a common symptom of liver damage, particularly in chronic liver diseases like cirrhosis. This swelling results from fluid retention and accumulation in the lower body parts, a condition often linked to liver dysfunction. When the liver is impaired, it fails to produce enough of the protein albumin, crucial for keeping fluid in the bloodstream. Additionally, liver damage can lead to increased pressure in the abdominal blood vessels, portal hypertension, causing fluid to leak into surrounding tissues. This symptom, especially when accompanied by other signs of liver damage, warrants medical attention for proper diagnosis and management. Number 4. Itchy skin, medically known as pruritus, is a less visible but often distressing symptom of liver damage, particularly in conditions like cholestasis where bile flow is obstructed. When the liver is damaged, it struggles to process and eliminate certain substances, including bile salts. These bile salts can accumulate in the bloodstream and deposit in the skin, causing persistent itching. This type of itching is unique to liver disorders and often intensifies during the evening or night. It's a significant symptom because it can be one of the early indicators of liver issues, even before more apparent symptoms like jaundice appear. Addressing it involves treating the underlying liver condition. Number 5. Dark urine is a notable symptom often associated with liver damage. It occurs when the liver, impaired by conditions like hepatitis or cirrhosis, fails to process bilirubin effectively. Bilirubin, a byproduct of red blood cell breakdown, is normally metabolized by the liver and excreted in bile. When liver function is compromised, bilirubin levels rise in the bloodstream and are excreted through the kidneys, leading to urine that is much darker than normal. This can range from a deep yellow to a brown color. Accompanied by other symptoms like jaundice or pale stools, dark urine is a clear indicator of liver dysfunction and requires medical evaluation. Number 6. Pale stool color can indicate liver damage, as the liver's role includes bile production, which gives stools their normal brown color. When liver function is impaired, due to conditions like hepatitis, cirrhosis, or blockages in the bile ducts, bile secretion into the intestines is reduced or halted. This lack of bile results in stools that are pale, clay-colored, or even whitish. This change in stool color is a crucial sign, especially when accompanied by other symptoms of liver dysfunction, such as jaundice or dark urine. It suggests a significant disruption in the liver's ability to process and excrete bile, warranting medical attention. Number 7. Chronic fatigue, a persistent and overwhelming sense of tiredness, is a subtle but significant symptom of liver damage. Unlike ordinary fatigue that resolves with rest, this condition persists and can severely impact daily life. The liver plays a vital role in energy regulation and detoxification. When it's damaged, as seen in conditions like hepatitis or cirrhosis, its efficiency in these processes diminishes. This leads to an accumulation of toxins and a disruption in energy metabolism, contributing to a profound sense of fatigue. This symptom, especially when combined with other signs of liver dysfunction, should prompt medical evaluation and management of the underlying liver condition. Number 8. Nausea or vomiting can be significant symptoms indicating liver damage, especially in the context of advanced liver disease. When the liver is impaired, its ability to filter and detoxify the blood is compromised. This leads to an accumulation of toxins in the bloodstream, which can stimulate the brain's vomiting center and cause nausea or vomiting. Moreover, liver damage can disrupt bile flow, affecting digestion and exacerbating these symptoms. Persistent nausea or vomiting, particularly when combined with other liver disease symptoms like jaundice or abdominal pain, is a clear signal for medical attention, as it suggests substantial liver dysfunction requiring diagnosis and treatment. Number 9. Loss of appetite is a common symptom associated with liver damage and can be particularly concerning. The liver plays a critical role in digestion and metabolism. When it's damaged, as seen in conditions like hepatitis or cirrhosis, its ability to process nutrients and toxins is impaired, which can lead to a decreased desire to eat. This reduction in appetite often accompanies other symptoms such as nausea, abdominal discomfort, or changes in taste perception. Persistent loss of appetite can lead to weight loss and malnutrition, further complicating the condition of someone with liver disease. It's an important symptom that warrants medical evaluation and intervention. Number 10. The tendency to bruise easily is a notable symptom of liver damage, particularly indicative of conditions like cirrhosis. The liver is responsible for producing clotting factors, which are essential for blood coagulation. When liver function is compromised, the production of these factors decreases, leading to a higher risk of bruising even from minor bumps or injuries. This symptom often presents alongside other signs of liver dysfunction, such as prolonged bleeding from cuts or excessive bleeding during menstrual cycles. Easy bruising is a clear indicator that the liver's ability to perform its vital functions is impaired, necessitating a thorough medical evaluation and appropriate management. Number 11. Spider angiomas, also known as spider nevi, are small, spider-like blood vessels visible under the skin, often indicative of liver damage. These occur when estrogen levels rise due to impaired liver function, as seen in liver diseases like cirrhosis. The liver normally metabolizes estrogen, and when it's damaged, estrogen accumulates, causing blood vessels to dilate and form these distinct markings. Commonly appearing on the face, neck, and chest, spider angiomas are more than cosmetic concerns. Their presence, especially when multiple, can signal significant liver dysfunction. They are often accompanied by other liver-related symptoms and warrant medical evaluation to assess liver health. Number 12. Hepatic encephalopathy, characterized by confusion, drowsiness, and slurred speech, is a serious symptom of advanced liver damage. This condition occurs when the liver, severely impaired by diseases such as cirrhosis, fails to remove toxins from the blood effectively. Among these toxins, ammonia, a byproduct of protein metabolism, is particularly harmful. Normally detoxified by a healthy liver, elevated ammonia levels in the blood due to liver dysfunction can cross the blood-brain barrier, affecting brain function. Early stages may involve subtle cognitive changes, progressing to more severe symptoms like disorientation and loss of consciousness, necessitating immediate medical attention for proper management and treatment. It's important to remember that these symptoms can also be caused by other health conditions. If you experience any of these symptoms, it's advisable to consult a healthcare professional for proper diagnosis and treatment. Early detection of liver damage can lead to more effective treatment options.